Hi, my name is Ada Murillo, and I have David Schumer, and his date of birth is January 10, 1963. It doesn't show that he has allergies, so I'm gonna go ahead and get his medications and also making sure that his blood glucose level is 301. Okay. So first, let me clean my hands for 30 seconds. Now I'm gonna go and grab the supplies. So I'm gonna need an insulin NPH, 35 units. So let's look for the insulin NPH. This is the regular NPH. So this is a 10,000 and that's 100 units. So yeah, I'm gonna put it here. And then we need a regular insulin, and since he's 301, that will be 8 units. And that will be this one. And then we need the flu vaccine. Flu vaccine, where are you? I found you. Okay, and that will be 0.5. And we are gonna need 0.1 ml. So I'm gonna have to do my calculations for that one. Then we need heparin, and that will be 5,000 units. Okay, heparin, Lovenox, and I believe this is no, this is Ansep. Lovenox, Demo, heparin. There you are. Okay, 10,000 units per ml. Okay, let me do just a quick calculation here. So since we have, let's move this over here. Let's get the alcohol swabs, and then let's just make sure. So it's for the flu vaccine. Didn't I grab the flu vaccine? Yes, there you are. Okay, so for the flu vaccine, so we need 0.1 ml, and then we have 0.5 ml. So let's just use the calculator. Okay, so it will be 0.1 divided by 0.5, and that will be 0.2 that I made. So, okay. Okay, for the insulin, I need 43 units. So I'm gonna need 50 units syringe, and that's the orange one. Let me make sure that this is the one that says 50. No, it says yes, 50 units. Yes, right there. And then we need, what else do we need? Okay, we need the flu vaccine intramuscular, and that will be 1 ml. And then we're gonna need, since that's intramuscular, we're gonna need a 25.1 gauge and 1 inch. Okay, and then we're gonna need another 1 ml, and that's subcutaneous, and so for that is a 25 gauge by 5 and 8 inches. Okay. So now I'm gonna go ahead and prepare my injections. So let me just clean my hands one more time, making sure. I'm gonna wear my gloves now. I'm doing this for 30 seconds. 1, 2, 3, 30. Then preparing here. Okay, so I'm gonna have to use the NPH insulin first. I'm gonna put this on the side so I can do my labeling later. And let me just this. Okay. Get in there. So I'm gonna go ahead and I'm gonna put everything on the side. Yeah, so we're gonna start with the insulin. I'm gonna clean the tops for 30 seconds. So okay, 1, 2, 3, 30. Now let's use another one. 1, 2, 3, 30, 30. Okay. So, and now I'm looking for the orange syringe, but that's the one that we need to use. Before I continue, I need to rub it this. 1, 2, 3. Okay. So since these are total of 43 units, I'm gonna need to get air 30 units. 1, 25, 30, right there. And I'm gonna put for the MPH, I'm gonna put 35 units, and that's gonna left me, okay, 35, so I need to have 8 units left. Making sure that I'm not touching the needle. Okay, 6, 7, 8. Now I'm gonna put it in the regular insulin, the remaining, which is 8 units. Now I'm gonna put 8 units of the regular insulin. 5, 6, 7, 8. And I'm gonna need a second nurse to verify.
Okay, 5, 6, 8 units, regular, no air bubbles.
Okay, thank you. Now I'm gonna need to get 35 units of the MPH, and that will be a total of 43 units. Okay. So far, no air. 40, 41, 42, 43. So I'm gonna need a second nurse to verify.
Okay. 1, 2, 43 left for the MPH.
Thank you. Okay, oops. So I'm gonna do the scoop in now. Okay, that's good enough. I'm gonna put it here and then I'm gonna label. So that will be insulin, MPH, and regular. And that's my initials. Today's date is October 1st, 2015, and the time is 10:26. And we are putting a total of 43 units. So that will go with the insulin right here. Now we're gonna do the flu vaccine. So I'm gonna clean the top for 30 seconds. 1, 2, 3, 30. And now I'm gonna grab my 1 ml syringe, and since this is an intramuscular, so I'm gonna need the 25 1 inch. So let's open this first. And now let's open this one. Okay. And then we're gonna lock it here just to make sure that it's tight. And here we are gonna put it 0.2 ml. But we need some air first, so 1.2 right there. That's for the flu vaccine. And now I'm gonna get 0.2. right there. I'm gonna put more because I have some air there. Making sure. Okay, yes. Okay, so now we got rid of the air. It's good to go. We're gonna do the scoop in right there. Okay, and that's for the flu vaccine. And now we're gonna get the heparin. We're gonna clean it for 30 seconds. 1, 2, 3, 30. And now for this one, since we're gonna need 5,000 units and this has 10,000 units per ml, we are only gonna get 0.05 ml. Okay. And then the needle that I grab is the 25 gauge, 5/8 inches. I'm gonna put it here. Okay, it's tight. And now I'm gonna get 0.5 air. And we're gonna inject air here. And now we are gonna get 0.5 make sure some air in here. Okay, I'm gonna put it back because I need a second nurse to verify that I have my 0.5. Okay.
Oh, just a little. Oh, what's wrong? A little bit. Okay, so that's 0.5 of the heparin. Okay, good job.
Thank you. So I'm gonna do my scoop in. Okay, good enough. Okay, and that's all that I need for now. So I'm gonna grab more alcohol swabs so I can go ahead and see my patient. Just in case. Okay. Okay. Knock, knock. Hi, my name is Sarah. I'm a student nurse, and I'm going to be helping your nurse today to administer some injections. Okay, so I'm washing my hands for 30 seconds, and I'm making sure that I'm providing privacy for my client. Could you please verify your name and date of birth, please?
David Schumer, January 10th, 1963.
Okay, yeah, it confirms that I have the right patient, so we can go ahead and do the injection. So I'm going to give you today insulin, NPH, and the regular one, because it shows that your sugar levels are a little high, and we want to make sure that it's in the right level. And then we are going to give you the flu vaccine, because this is the time of the year and we want to make sure that you don't get the flu.
Okay.
And also we are going to give you the heparin. Yes, that's to avoid any clots in your blood, so that's for anticoagulation.
Okay.
Okay, so just to be sure, are you allergic to anything?
No, I'm not.
Okay, so we're going to start with the insulin, but I need to know if when was the last time that you got your insulin? It was in the right or left arm?
It was on the left side.
Okay, so this time we're going to give you on the right.
Okay.
So for this one, we're going to clean. And for that one, we're going to, since we're going to do in the abdomen, it's going to be 3 inches away from your umbilical.
Okay.
I don't see any lesions, any bruises, so we are going to go ahead and clean it for 30 seconds. 30 seconds are up. And we're gonna go ahead and give you your insulin. So you're gonna feel a pinch, so just take a deep breath.
Okay.
And we are gonna be done in less than a second. You see, well, sort of a second. Okay, 1, 2, 3. Okay, holding for 10 seconds. How are you feeling? Are you okay?
Good.
Okay, sharp, sharp, sharp. Okay, so now I'm gonna give you your flu vaccine.
Okay.
And since that's an intramuscular, we're gonna give you in your shoulder.
Okay.
Okay, that one. Do you have any preference, right or left?
No, doesn't matter.
Okay, so we're gonna give it on your right upper arm.
Okay.
And then it's gonna be 3 fingers below your chromial
Okay.
process. And I don't detect any lesions or bruises. So let me just wait until it's dry out. Okay, take another deep breath. Okay, so I'm pointing there. 90-degree angle. And here we go. Then, how are you feeling? Are you feeling good?
Yeah.
Okay. Sharp, sharp, sharp.
Okay.
And then finally we're gonna give you your heparin, and that's subcutaneous. So for that, I can use your left arm.
Okay.
Would that be good?
Yeah.
Okay. So let me just go ahead and clean it. Right here, I don't see any bruises or lesions, no prominence, so good to go. Okay, take a deep breath. Are you okay?
Mm-hmm.
Okay. 1, 2, 3. 10 seconds. Okay, how are you feeling? Are you feeling?
Yeah, feeling okay.
All right, so sharp, sharp, sharp. Okay, so let me just write down what I gave you today.
Okay.
So we gave you insulin and the regular insulin, the MPH, my initials, and then that was on the right abdomen, both of them. And then we gave you the flu vaccine, and that was on your right upper arm. And then we gave you the heparin on the left upper arm. And let me put my initials here, your signature. Before I go, is there anything else I can do for you?
Nope. Fine.
Okay, let me give you the cold light.
Okay.
And I'm washing my hands as I leave the room. And I'll be checking on you in 30 minutes to make sure that everything is okay. Okay?
Okay.